Wessex is quite unique in the population that it has. Within Dorset, around 112,000 people are termed as armed forces community. Either they're veterans, they're serving, or they're dependencies. So they might be a child of, a wife or husband or partner of, or they might be a carer of. And that represents nearly 12.5% of our population. If you look across Wessex as a whole, we've got significant armed forces communities based here. We have the naval base at Portsmouth. We have RAF Odium in Hampshire. We have, just on the Salisbury Plain, the biggest army garrison of Bulford and Tidworth. We've also got the Air Yeovil with the aviation, and we've also got Gurton Dorset, the Armoured Corps at Bovington, and the Royal Signals at Blandford. And we also have other elements around the coast as well. So it's a huge serving population. More importantly, it's a huge veterans population. So armed forces research is being done elsewhere in the country, and some areas are really well developed, but we've decided to look at areas that are more undeveloped. So the kind of areas we're focusing on is things like gambling addiction. Another area we're looking at, which is quite interesting, is domestic violence that's hidden under the radar in certain communities within the armed forces. Another area we're looking at as well is dementia. Dementia seems to be occurring earlier in a veterans population, but we don't know why. We need to understand what that lived experience is for an armed forces person and whether that impacts on their health and well-being. And if it does, and we can then do something to intervene, then that's all to the good.